Hi, I'm Rehan. I'm a 25-year-old lawyer and I want to reverse engineer my vision of a fulfilling life. And so I thought I would have conversations with people having different experiences than mine and hopefully learn a thing or two. Our guest today is Tanay, a psychiatrist who's here to speak about the medical side of mental health. Let's get into it. Thanks, Tanay, for coming on.
Thank you for having me.
For the viewers watching, a brief background about Tanay is a resident psychiatrist and he's also a little bit of a content maker. And I wanted to bring him on today to speak about his role as a psychiatrist in dealing and seeing mental health patients, because the overarching theme of these episodes is on mental health specifically, the incidences that he's seen, the role of a psychiatrist, and the stigma behind medication, which we see prescribed today, the effects of it, common answers to the questions we see when the idea of a designated mental health illness arises. Because there's one thing to have a prescribed illness which you have been diagnosed with. There's one thing to just say that I am depressed or I am anxious. So where that distinction arises, the importance medication plays a part, and understanding the role of a psychiatrist. So thanks, Tanay. First and foremost, as I just stated, what is the role of a psychiatrist and how does it differ from a psychologist?
So, a psychiatrist is a doctor who's completed his MBBS followed by a 3-year training program in the field of psychiatry. It's called residency, which is what I'm currently doing. And psychiatrists are allowed to prescribe medication because they have a medical degree, and they differ from psychologists in the sense that psychologists are more focused on the therapy aspect of it, the non-pharmacological interventions, as we say. So talk therapy, cognitive behavioral therapy, CBT, DBT, things like that. And that the main difference is the ability to prescribe medication and what the focus of our treatment is. Psychiatrists focus on the medication, and psychologists or therapists focus more on the therapy aspect of it.
So would you say the psychologist comes before the psychiatrist?
It depends on how the patient, which practitioner the patient approaches first. So let's say you're facing a slight disturbance in your mood, you think you're a little sad, you're a little irritable. If you want to seek care, more than likely you'll seek care from a psychologist first. You'll say, let me speak to someone, let me see what this is about and try to figure it out. But there are disturbances which can occur very fast, which can be quite severe. So if you're severely depressed, if all of a sudden your parents find you're not sleeping, you're not eating, you seem low, you don't talk to anyone, you've lost all interest, at that point it's more like it's better if you consult a psychiatrist first, because the condition has progressed or is at a stage which requires more acute intervention than what therapy can.
Well, that's a very interesting distinction, which I don't think people know the difference of. And why psychiatry for you?
Psychiatry is something I came to in my internship, which is the last year of your MBBS training, where you rotate through different fields and you kind of explore that field for yourself and see if it suits you. In your MBBS journey, you get very little exposure to psychiatry. It's mostly focused on the major fields. But when I got to psychiatry, I had already eliminated several of the major fields because their lifestyle and the work environment and even the field itself wasn't very interesting to me. What I loved about medicine is the fact that you get to interact with patients and you get to understand their story, you form a connection and you help them heal. I felt psychiatry was the only field that allowed me to do that, and it's a core part of it. So.
Okay, that's a very good answer. But I usually start my show with asking the guest, what is the best piece of advice they have received? But I want to tailor-make the question that I've asked for you. What is the best piece of advice you have received which has benefited your mental health or helped you go through the pressure environment that is MBBS the most?
For me, it came from my father primarily, but both my parents. My mother says it more subtly, but is to not lose any childlike sense of wonder that you have. It's something that I think happens a lot as you move through your life. You get a little jaded, you get a little, you form your certain judgments and you're kind of set in that. And you tend to lose your sense of wonder about simple things. So what's helped me a lot is to try and maintain that sense of wonder. When I come across new things, I try to meet it with an open mind and to get excited about something new. And even if it's something small, the novelty of it really helps me, and it helps me look forward to things because I'm aware of the fact that there are so many new things I'll get to experience.
And then you don't take yourself too seriously.
I don't take myself too seriously.
Which is, I think, the best thing about it. Because let's say both of us were in serious professions, where it's very hard to let the stresses of the profession take over your day-to-day existence. I think that's great advice.
Yeah, thank you.
So yeah, so going back to what you brought up is that a psychiatrist has the ability to prescribe medication because they're a certified doctor.
Yeah.
What kind of medication are these? Like, what are the usual medications that you prescribe specifically for mental health patients?
Sure. So broadly, there are only a few classes of medication that you deal with on a day-to-day basis. It depends on the patient's condition. But if I had to describe the classes, they're called broadly antidepressants, mood stabilizers, anxiolytics, antipsychotics, and medications for ADHD and neurodivergent conditions like that. So.
And what do you think one is for any of the subset of medications that you prescribe? What is the potential of any of them becoming or falling addictive for the patient? And do any of these medications have long-term consequences if they're taken over a period of time? And when do you know you need to prescribe it?
Sure.
Because I think that you can only gauge in when you converse. But what are some of the telltale signs that you see firsthand which makes you think, I need to take that step and prescribe this?
Sure. Okay. So I'd like to answer the last part first. When we're talking about actually prescribing and intervening using medication, the thing we tend to focus on is impairment. When we talk about impairment, it can be in various fields of life. It can be your personal life, your social life, your work. And if you are facing impairment or your biological functions, your sleep, your appetite, things like that, if there is significant impairment in any of those things, it's a pretty good sign that they need help using medication, because you need to get them out of this quicker, just to prevent any harm that might happen if you allow this to continue for too long. It's always patient dependent. You have to talk to the patient and get their consent to start medication. You have to explain what medication will look like, how long they'd have to take it, roughly. You can never predict exactly. And if you can form that alliance with them, that shows them that you are willing to listen to their concerns even about the medication and guide them through this, then most times you're good to go. And in terms of medications so there are medications that we know have a higher, what we call dependence potential. So things like anxiolytics, which typically the ones you use are called benzodiazepines.
What are those? Just for like a simplified version of that.
So benzodiazepines are pills that are medications that you use which will bring down a person's subjective sense of anxiety in the moment, immediately. So if I give it to you now, if you're anxious, it's very likely that in the next 10 minutes you'll feel a lot better, which explains their dependence causing potential, right? Because if I give them to you and you know that I'll feel better when I'm anxious immediately after taking them, you're more likely to take them more often. So it depends on how you prescribe them. These medications are extremely useful. So I don't want to paint them in a negative light. They are useful when they are used in the way that they're meant to be used. So if you go to someone, let's say you go to a psychiatrist and they tell you're having panic attacks, you're extremely distressed and you're not able to sleep. You're lying in bed 6 hours, 7 hours, you're just not falling asleep. At that point, the prescription of a benzodiazepine generally is sensible because it's required to bring that sense of rest and ease back to the patient. If they're overprescribed, let's say someone tells you to take it, like if you end up taking it 3 times a day, you're taking it 3 times a day for many, many weeks. And at that point, if I try to reduce it even a little bit, you're going to face some difficulty because you're so used to feeling that sense of ease through the day. So even with those, in those medications too, any medication from those which can cause instant relief and last for a short amount of time will have a higher dependence potential because it'll bring you instant relief, it'll wear off, you'll want more. And there are options even in the same class of drugs which take a little longer to act and last much longer. So if you are looking at someone who you're worried may develop dependence, which you can analyze to some extent, you would prefer those options.
But I think that's very, very useful information. But I want to go a step back further to understand. Now, let's say, what is depression for you? What is anxiety for you? What is your definition of ADHD? Where do you know? Because when people think that in the distracted world they live in today, that they don't have the ability to concentrate. I am someone who has been diagnosed as dyslexic and has ADHD, but who's doing his residency and understands that a government hospital is the one that diagnoses you and on the basis of which you are clinically proven to have these form of like mental, you could call it quote unquote mental illnesses, though I feel like they can be incredibly worked upon. But what is your true definition of that, and why what is the place where one may think that they're actually suffering from it versus what they think they're suffering from.
Got it.
If you understand, yeah.
So I think that for us, our job is made quite easy because there are criteria that are decided internationally. There are two schools of thought broadly, which is the DSM-5, which is it's written in America. They have a different focus on mental illness, which is more based on their cultural beliefs. And there's the International Classification of Diseases. The 11th edition has been brought out, I think, 3 years ago in 2022. And they lay out criteria for the diagnosis of all of these mental illnesses. So if you're talking about something like depression in the DSM, there's 2 core criteria, which is persistent sadness of mood and a complete loss of interest or a reduction in your interest in daily activities, followed by various other things such as loss of energy, loss of concentration, loss of motivation, disturbances of sleep, appetite, things like that. And if a person is meeting those criteria, you can diagnose them as major depressive disorders.
But what about anxiety? Because I think that is a feeling, because I think it is a feeling at the end of the day that people are suffering from more than they ever have before.
Yep.
I would say it is incredibly linked to perception of oneself, linked to Instagram, it's linked to acceptance in society, it is linked to pressures from parents, self-perceived, and I think if there's one specific feeling or illness, you could describe it as what is what, that people are suffering from more than anything else, it is anxiety. So what is your clinical definition of anxiety? And why is that something you see in your practice as well? Like, do you see, what is a subset of a mental illness do you see more than others? And why do you think that is? So it's a 3-part question.
So anxiety is a very broad term. There are various forms of anxiety. It could be something specific as feeling conscious about your appearance, feeling anxious about it when you step out. It could be a sense of generalized anxiety where you feel anxious about most aspects of your life. If you have to leave and go 2 stations over, you might feel anxious. If you are worried about an exam, you'll feel anxious. If you're worried about your cooking, you might need to cook a meal. You might even feel worried about that. At that point, you're experiencing a sense of generalized anxiety. So the term is very, very broad. The best way to think about it for most people would be that anxiety is a sense of restlessness and worry that you might feel even in various aspects of your life at any given point of time, which is normal to a certain degree. If I'm going on stage or if I'm speaking to someone for the first time who's important to me, I will feel that sense of anxiety. I will feel worried. Again, the game is all about impairment. How much is that anxiety really causing me distress? How much is it affecting my daily life? How much is it leading me to avoid things that I would normally do? Like if I am just a little anxious before speaking on stage, that's fine. And if I get through it, that's okay. But if I'm consistently avoiding doing that just because I'm really, really worried that something bad is going to happen and then it's part of my job, but I'm still ignoring it, then you're clinically anxious. So I think now there are many, many sources for a person's anxiety. There's the internet being one of them, because there's this constant comparison, constant feeling like you're not doing enough, constantly feeling like you're not where you should be, which is something, again, I think we all have experienced at some point.
I think it's comparison as well.
Yeah,
like
consistently.
Like where because everyone on a social platform will always put their best self forward, but that's not what they truly feel. But when you see that version, you assume that that's how they feel all the time, and which makes you feel a lot worse than what the real truth is.
True.
But is that one subset that you've now seen more than like ever before?
So the patients I tend to deal with are patients from like lower socioeconomic classes. So where I've studied for my MBBS was in a government hospital. Where I'm working now is a trust hospital. So the kind of concerns they come in with are very, very different from what I'd see outside of that world. They're usually dealing with problems that we wouldn't think twice about. So money, housing, education, those are their concerns. And comparison only comes in the sense of, oh, my neighbor's able to send their kid to a certain school and I'm not able to send my kid to a certain school.
But the feeling is the same.
The feeling is the same.
Yeah. The cause of it may be different, which is what I truly believe about feelings, negative feelings that come about, is though no two persons' causes could be the same, or they could, but what they end up feeling is the same, which is you're still falling into that feeling of comparison, which is why it's never right to judge the cause.
100%.
And it's always right to look at a circumstance for as it is.
100%. You have to judge. So a person's illness or the person's state of mind has to be judged within the context of their world, which you have to get used to, you have to get accustomed to. So outside of my world where I'm training, when I speak to people, even in my family, I see people who are constantly comparing themselves to people online. They have a sense of need to go further, to do something more. Fame is a huge part of it as well, because they tend to think if someone is famous, then their lives are all good. They don't have to worry about it and they have money. And you want to get to that stage as well. And it could be about smaller things as well, about how good like what car they're driving, or what kind of clothes they wear, or how their body looks. Body image is also a huge thing right now.
I'm sure. Yeah.
So the sense of comparison is pervasive throughout like the human experience,
Yeah.
and the cause and the source of the comparison might be different, but it is a source of anxiety for a lot of
But
people.
do you think in your primary interactions, had you learned to train yourself to look at it not from your own lens? Because
yeah.
I think that must have been a very interesting step for you, because everyone looks at a situation from a lens of their prior experiences.
Sure.
So how did you train yourself to disassociate the two and look for situation as it is?
So I think one of the hardest things about being or working in mental health is that you have to let go of your own biases. And when I mean biases, I think for me at least, broader cultural biases are easier to let go of because there's a sense of morality in that too. Smaller things are harder. Like I remember someone who came to me and said that they were anxious because their child had to give the 10th standard board exam. And they were clinically anxious about that.
Yeah, okay.
Which in my second month of training, I was like, there's just no need to be so anxious about it. But in their frame of mind, in their reference, that was their first kid who was going to pass 10th standard. It was a very important exam. They considered that a milestone for them and their family. So there was a lot of pressure on that moment. And I think that's down to the guidance of those who've taught me, and my parents as well, who've taught me not to judge and kind of be open when you're speaking to someone, because if you can't empathize with them, you're never really going to be able to help them.
Yeah, so I think that brings me back to a quote that my Nana used to always say, who came from incredibly humble beginnings, where he's incredibly generous today because he understands what people go through. But I guess because of his sacrifices, my mum or like me will never be able to empathize what he went through. But it's a quote that he keeps saying is that you may never understand a situation, but you can't not feel their pain.
Yeah.
It's like you can still find a way to empathize when you put yourself in their shoes, even though you can't do it based on your own experiences. But
Exactly.
if you just disassociate the two and then you judge it for as it is.
Exactly.
I think
I say this all the time. It's empathy, not sympathy. If I sympathize with someone, it does them no good because I'm kind of focused on how I'm feeling about it versus
feeling it with them.
Yeah.
Yeah,
Versus empathizing and being like, I understand why you're feeling this way. Let's do something about it.
And which for us as guys
Yeah.
is a difficult thing to
It
begin
is.
with anyway, because I think women are they do it far better than we can.
Yeah.
Because I think it's very easy for us to be reactive and not responsive. And let's say if you're dealing with friends who are women or you're in a relationship, we're so solution driven that when you're trying to connect with someone on an empirical level through empathy, that's not the first thought that comes into our minds as guys.
Yeah.
And have you seen that firsthand as well dealing with male patients? Like if there is a disassociation between a male and a female, women are far more in tune with their feelings than us as men are.
Yeah. So even I think a lot of people assume that mental health, like I've heard people in my family and extended family say this, though depression is a disease of the rich. You know, that people focused on their feelings feel depressed. Those who are poor don't.
Don't
And
have time for this
yeah,
only.
It's just not true.
Yeah.
It's the furthest thing from the truth, because yes, men don't tend to focus on their feelings because they are feeling a sense of responsibility because of the system that we all live in, which is largely patriarchal. And they feel a sense that I need to find a solution to a problem. If I don't, nobody will. Women in their own way have a sense of responsibility for the household, and they can feel that same pressure as well. Like you will not find women very open to complaining about household work. because it's just a given that they have to do it. Even if that means they're cooking for 8 people every day, they're doing 3 times a day, they're managing everything else, they're managing their kids alone as well. So I think that yes, men are less likely to express or even focus on their emotions, which is a challenge you face all the time, because to even get them to admit that it's okay to feel sad, or to like it's okay to feel hopeless or feel like you need to cry, and to actually cry too. It's another step in the journey, but it's a little different for
It's
women.
that baseline belief that if I show some form of feelings, I am weak.
Yeah.
And weakness will be taken advantage of.
Yeah.
And us, at least me personally, is a feeling that I used to have before when I was a lot younger and I think a little less immature and less introspective, was that by me running away from those feelings, there was a position of strength, because if I can't feel it, it can't hurt me.
Yeah.
So actually running away from a feeling of pain, which is something the dumbest thing one could do, because then it's just running after you even more.
Yeah.
And you can't run away from it.
It will catch up.
It will catch up.
will
And when it catches up, it hits you like a brick.
Yeah.
And then you realize the importance of accepting it and hoping that henceforth you take it for what it is.
Yeah.
To go into the next segment of what I wanted to speak to you about immensely was the importance and influence of the medication that you mentioned, and how does it impact you? Now, I'll give you an example of ADHD medicine.
Sure.
I was prescribed Inspiral. When I was very young, I was prescribed Inspiral 10 when I was in school, and when I was in college and law school, Inspiral 20. I had prescribed a maximum dosage of truly when I needed about 60 milligrams of methylphenidate hydrate, the chemical. I had tried Concerta, I had tried an Inspiral, and I found that Inspiral worked for me better than Concerta, and I preferred the fast release of Inspiral versus the slow release. For context, the fast release was immediate concentration.
Yeah.
The slow release was the dosage is sort of given across the day, and I was only able to get the prescription because I was diagnosed
With ADHD.
with ADHD by a doctor himself, doctor herself. It was a doctor who did it. And it started from there. I was on Inspiral. I noticed immense side effects that I faced. Loss of appetite. Mood wasn't very good. It was up and down. Going into, obviously the concentration was phenomenal on subjects which were incredibly mundane, which I don't think in 10th standard, 11th standard, 12th standard, or in college, early on, would I have even thought of studying. I felt like I was reliant on it. There was complete loss of appetite. And most importantly, what was worrisome for me was there was very big sleep disruption, which I think exasperated everything else that I just mentioned, because sleep is at the forefront. And then recently I undertook the solicitor's exam, wherein I was able to study I studied for 6 papers. I cleared 5 and I just regave 1. For the 5 papers, I didn't take ADHD medication, and that was the hardest thing that I've ever done. Personally, although because the solicitors were incredibly hard, but also not doing it without medication for the first time in my life was an incredible switch, because I thought I was reliant on that from day one. And secondly, for the last paper that I had to re-give, because of how stressed I was, I ended up taking the medication again. So, where is the line between how useful is it? Why are the side effects as bad as they are? Did I face it worse than others? And how can one manage that when they have been prescribed it? And how can one find coping mechanisms when they get off it and not relapse?
Let me break that down into a few parts. First, let's try to understand what methylphenidate does, which Inspiral is methylphenidate. The mechanism is basically it blocks the reuptake of 2 chemicals, which is norepinephrine and dopamine, and it builds their concentration in what's called your synapses, the connection between 2 nerves. Those 2 and a balance of those 2 are critical to us maintaining attention. So the side effects come from the fact that those 2 chemicals are not involved in just that process. They're involved in a lot more. So they are involved in your appetite, they're involved in your mood, and they are involved in your sleep. I think that if the usual strategy is, you'll hear this all the time in psychiatry, is start low and go slow. So when you're starting a medication, start at the lowest possible dose that you can, and up titrate or increase the dose extremely slowly, so you can judge what kind of side effects a patient is facing at what stage. The most important thing I have found in my experience is that when you're starting these kinds of medications to a patient, you should educate them as much as possible about the side effects that they may face. And if they do face those side effects, you ask them to come back immediately. Because it's very, very hard to predict which patient will face the side effects worse than others, because broadly we know that these things are possible, but I can't narrow it down to you probably facing it a little more than someone else facing it. So starting low again helps with that, but educating the patient helps a lot too. It also helps with the patient feeling a sense of trust and establishing what we call a therapeutic alliance. So that's that. The second part of it, which was how do you get off it? I think that there are some conditions for which you can take medication, increase the dose slowly, feel good for a time, then try to reduce and stop the medication, and you're good. Conditions, even the people might not believe this, but most cases of depression can eventually get off medication if done with proper follow-ups and proper care and therapy sought out at the same time. But there are certain conditions which is harder to do. So schizophrenia, bipolar disorder, things like that. Those patients usually require medication for a much longer time and possibly even lifelong. With ADHD, there's no exact guidelines in the sense of when you should start and when you should stop. There is a guideline for when you should start, but as this by the criteria. But if I start the medication, let's say you were on it and you stopped it for a certain amount of time, maybe you'd be fine, maybe you won't. It would depend on your experience with it entirely. The best way you can ensure that a patient can at least reduce their dose is to help them build skills while they're on the medication, which they can rely on once they're off the medication. So with ADHD, it's primarily an attention deficit, right? Into adulthood, the hyperactivity component tends to subside. So the attention deficit can be addressed in various ways. One is things like removing the things that cause distraction.
Which is what I did. What worked for me was not eating heavily, anything heavy in the first half of the day, of not eating at all. At least this is what I did during my solicitors. Learning how to meditate, meditating a little bit through this Art of Living course. Second was no phone first half. So you start on a clean slate. Sleeping about 8 to 9 hours. Making sure I'm in bed by about 10:30, 11 every night, non-negotiable. Up at 6:30, 7, 8, and immediately you start your day. You start your day with a workout, and then you're immediately then locked in. And then beating that first 10-minute hump, where it is possibly, I don't know how people relate or understand to this, but when that book is in front of you and everything in your body is fighting you to not do it, because and you're staring at it and you knowing you have to do it. And for ADHD people, stress is a big form of motivation, and which is why people, at least how I used to be, was if it's close to a deadline and there's a reason to focus, I will go into a state of hyper focus and I will do what I need to do very well. But until I'm in that stage of high stress, I can't do it to the best of my ability because I'm fighting a wall and there's no reason. But actually fighting that initial thought of mine, knowing fully well that this is what's going to happen, and fighting those 15 minutes of looking at the book and nothing getting assimilated was the hardest thing to go through. But after the 15-minute hump, then it was good sailing for like an hour and a half. But doing that on a daily basis. Because every hour and a half, 2 hours of hyper focus, I go into a state of drain. Where if I took the Inspiral, I could go non-stop studying for about 3.5 hours on that 20 milligram without even thinking twice. For someone with diagnosed ADHD, what has happened to my dopamine receptors to begin with that cause me to go into states of hyperfocus and non-focus, and especially hyperfocus on things I'm passionate about. Like if I'm reading something on philosophy or stoicism or like any form, like a business book, I can spend the whole day reading it and I love it because I love reading. And I've forced myself to learn how to love reading and now I love reading. But if you want me to open up and read something about like a law which I'm absolutely not interested in, or I don't see the utility of it, like I won't be able to read a head or toe of it unless I have to. So and that's for solicitors, a lot of the subjects were like, what is this? And so you're forced to read it. So why is the reason that one with ADHD suffers from this?
So with ADHD, as I was explaining, when I say that norepinephrine and dopamine are involved, it's not so much the receptors for this particular condition as it is the levels of those medications and the levels of those transmitters. So norepinephrine and dopamine in your mind need to be at a certain balance for you to make attention. Norepinephrine is important with you trying to focus. Dopamine is more important with blocking out irrelevant information. So when that balance is maintained, you can focus. ADHD is what we call a neurodevelopmental condition where from your early childhood, your levels of those two chemicals aren't quite balanced. So you will have probably a reduction in norepinephrine and dopamine, which we try to increase using the medication. And in a perfect balance, your focus is back. What can also happen is if you go a little too high on the medication, you might face the opposite effects. What you will start losing focus and losing attention. So broadly, that is the reason for the lack of attention on a particular thing. Another specific thing with ADHD is that things of interest you will be able to do them, but things which you're not interested in, which just don't grab your attention instinctually, will be harder for you. And this is for everyone, but it's more pronounced in ADHD. So I think that with that, that's why when we talk about ADHD, we don't talk about it in just general sense, like is this person he just has difficulty focusing. That's not how we think about it. Think about it as it's at least in more than two domains of their life. So I have difficulty focusing on my academics, or I have difficulty focusing at work. I have difficulty focusing on conversations. So it has to be at least two which you are facing that problem in, because it's not that you will not have the ability to focus on anything. You will focus on some things, which is easier, but you won't focus on things that cause.
So for me, it was obviously studying growing up, and I played competitive badminton. And it was in a sustained 3-game a match, maintaining my concentration throughout the whole match, not just one game. Because let's say in the tighter moments, the concentration would invariably fall. And that's when I was diagnosed with it completely. There is a lot of stigma associated with medication in general for mental illnesses specifically. Whereas, let's say my parents' generation or beyond, if someone is on antidepressants or someone is on anti-anxiety, the first thought that comes to your mind is, there's something wrong with this person. Rather than, it's not like someone was to say taking an antibiotic, or someone is supposed to take like a multivitamin on a daily basis, or someone taking like even like a metformin for diabetes. They're supposed to take it because they need it. Because there's a lot of stigma associated with mental illnesses themselves. Like I was for the long time fearful of even admitting that I had ADHD because of the perception it would give that I was stupid. And though the medication helped my school grades immensely and helped me with my entrance test scores where I did well in, or like helped me in college with marks, all of that, well and good. But the feeling I also innately faced was I am reliant on medication to do well. And that's not something I should be proud of. Because again, it was a stigma that was associated to me, and therefore I embarked on this adventure of doing the salts without Inspiral. What do you think is the root cause of the stigma, and why should it be broken?
Sure. So stigma in general, and particularly for mental health, just stems from a lack of awareness of it. Mental health is something that's discussed more openly now after many, many years of it not being discussed at all. People who suffering from mental illnesses were generally just shunned away from society, kept in a place which is not so great, and everybody else just seemed to move on. Now with the conversation opening up, I think people are learning a little bit more, but mental illness is also hard to see, right? So even something as simple as having high blood pressure, if I record your blood pressure now, you'll see a number and you'll see that this is happening. But when I talk about mental illness or mood, older generation's attitude would just be like, why are you sad? Like, go to work. Or why are you sad? Just do something you enjoy. Like, as if it's just about that, which is not entirely their fault. They were raised in a different time. But just that lack of awareness is the root cause of the stigma. And I think that the best way for someone to deal with it and to move past the stigma is just to educate themselves about it. This is not even limited to an older generation. I meet plenty of people now who ask me things like, oh, are you worried you'll suffer from mental illnesses because you're around people with mental illness all the time? This is a question I get every second day. The truth of the matter is that if you spend enough time with these people suffering from mental illnesses, the whole mystery of the mental illness just goes away. you can see past it and see that they're just people. Because once you've seen a person recover from what you would consider a very severe mental illness, you get to speak to them as well, and you realize that they're just another person like anyone
And you
else.
just treat it as an illness.
You treat it as an illness.
Yeah, there doesn't have to be the connotation of it being a mental illness and
Exactly.
therefore treat it as differently. You
Exactly.
treat it as a patient with an illness and that's it.
Exactly.
And that is what it is. It's nothing more, nothing less.
Yeah.
But there is also, in the age that we live in today, a hell of self-diagnosis.
Yep.
Whereas one's self-perception of I am anxious
Yep.
and therefore I need medication, and medication is freely available,
Yeah.
unfortunately, and
True.
very abused as well. How does one sort of control that? At least because I know someone personally that was on anti-anxiety medicines and high forms, and when she was like tapered off and it came off it, or it took a toll
Yep.
on that person. Yeah, so I usually end the segment with two questions I ask my guests. One is a previous question, and that the former guest has asked for you, and two is a question you would leave for the next guest.
Okay.
So Savar, who was the previous guest, had a very, very interesting question for you. He asked whether, like, what was the most transformative and challenging experience that you faced, and whether they one and the same, and how has that impacted you?
Someone close to me went through a very serious health condition, and it was at a time when I was already a doctor. So I kind of became the person that people look to for advice, but I was lost myself, and I'd never dealt with anything like that before. Fortunately, I had people around me who understood that and kind of took over while I got my bearings, and we were very lucky to get the help that we did. I think just going through that and understanding that it's okay for me to step back in my role as a doctor in my family has really helped me kind of draw a boundary between my work life and my personal life, and just kind of focus on when I need to do my job and when I don't. And learning that, I think, will serve me really, really well going forward, because until that point, I just took on the default role of caregiver for everybody, at least in my mind.
And also not just you. I think what you said is so powerful, and it's something I struggle with, because I am supposed to or expected to be at a high performer all the time.
Yeah.
Serious, executing work, getting shit done, and that's your baseline expectation, right? And sometimes you take that seriousness to your personal relationships as well.
Yeah.
Where sometimes you forget to chill out.
Yeah.
Which I think is something in like professions that both of us are in is very important, that downtime, because you may not have much of it, but when you do have it, the ability to switch off is the most important.
Very,
so I think
very
what you said is very powerful advice.
Thank you.
And what sort of question would you lay on to the next guest, who's Adi, who's coming up?
Adi, I think you mentioned vulnerability will be a topic. So I'd just like to ask him how he came to understand and explore his vulnerability, and how has that helped him shape his new reality for himself.
Okay. Thanks for coming.
Thank you, man.